Well, good morning. At the start of this month, we were faced with much uncertainty as our state and most of the nation was experiencing the most significant surge in COVID-19 since the pandemic began. As I stand before you today, I am pleased to say that we're seeing steady signs of improvement, but we still have much work to do to improve our current situation and ensure that we can effectively and responsibly manage it throughout the winter months. During the first week of November, Iowa reported more than 28,000 new cases of COVID-19 and a statewide average positivity rate of nearly 32%. The following week, November 8th through the 14th, new cases rose to nearly 30,000. The positivity rate was just under 29%, and hospitalizations began climbing at an alarming rate. On November 10th and again on the 16th, additional mitigation measures were put in place, including mask requirements indoor public spaces where Iowans couldn't social distance, limiting gatherings to 15 people indoors, restrictions on some organized sports, reducing inpatient elective procedures to ensure that hospital beds were available, and limited hours of operations for bars and restaurants. During the week of November 15th through the 21st, we saw new cases decrease to 24,210, and the positivity rate dropped to 21%, a slight improvement, but still too high, and the number of Iowans hospitalized with COVID-19 peaked at 1,510. Last week, from November 22nd through the 28th, we saw our most significant progress in weeks. More than 14,200 new cases were reported, about half of the previous week's total, and the positivity rate was at 15%, a 6% drop. So even though most testing stopped for the day of Thanksgiving, more than 95,000 Iowans were still tested last week, which is several thousand more than were tested during the first week of November. And further results indicate that the decline in cases and positivity isn't simply because of the holiday. At a local level, many counties are reporting positivity rates over time that are either stabilizing or decreasing. We've also seen the hospitalization rate decrease almost day over day since its peak on November 17th. Equally encouraging, new admissions and ICU utilization are also declining. We continue to monitor this slow, steady progress and remain in close contact with our healthcare partners. Unfortunately, as you are aware of, cases in long-term care facilities are continuing to increase. Routine testing of staff and residents is generating more positive results and putting more facilities in outbreak status. As I mentioned last week, the Department of Public Health and the Department of Inspection and Appeals continue to work closely with these facilities to ensure adequate infection control and other mitigation measures are being taken. Now that Thanksgiving has passed, we're also going to be closely monitoring case counts, positivity rate, and hospitalization over the next 2 weeks for any significant increase. Experience has shown us that holiday events can result in an increase in new cases after family and friends have gathered to celebrate. However, we are cautiously optimistic that the mitigation efforts currently in place are achieving what they are intended to do, and that is decrease the spread of the virus and get it into a more manageable level. These are steps. These are not steps that I take lightly because I understand the impact that they have on Iowans, but I believe they were necessary at the time. We've remained targeted in our approach, and while I didn't close any businesses, the limited hours of operations and the social distancing requirements have had an impact on our hospitality industry through no fault of their own. It's time for Congress to come together and get a relief package passed and get some relief to our small businesses and Iowa families who are suffering. So even though the progress we're making is reassuring, we're not out of the woods. It is going to continue to take all of us working together to make that possible. So now is not the time to let up on our efforts. So I'm just asking Iowans to continue to do the right thing like you have been. I appreciate the efforts that everybody is putting in place so we can continue to see those numbers come down and, again, hopefully get things back to more of a manageable number. Last week, more than 19,100 individuals were tested at the 5 drive-through Test Iowa sites and clinics statewide, even though sites were closed on Thanksgiving Day. We also marked the highest number of tests ever conducted through Test Iowa in a single day, with 6,703 Iowans tested last Monday alone. That exceeds our daily capacity by more than 700 tests, and it breaks the previous record by nearly 100. With virus activity across the state at its highest sustained level since the pandemic started, it's not surprising that demand for testing is also at an all-time high. As the seasons began to change, we knew it would be critical to maintain operations of the 5 drive-through sites located in some of our state's most populated areas throughout the winter months. But we recognized that adjustments would be necessary to accommodate the weather and protect Test Iowa staff as well as those being tested. Homeland Security Emergency Management, together with the county emergency managers and others, went to work to identify and secure enclosed sites that would allow convenience and efficiency of drive-through testing to continue throughout the months ahead. Over the last several weeks, 4 out of the 5 state-operated Test Iowa sites have been successfully relocated to enclosed buildings in Des Moines, Cedar Rapids, Davenport, and Waterloo. The sites range from industrial buildings to a Windsor Lines bus facility and a former Sears Auto Center. The site in Council Bluffs has been the only one remaining without an enclosed building secured for winter operations until now. I'm pleased to announce that the Test Iowa site, currently located at the Western Trails Historic Center, will be relocated after testing concludes on Friday, December 4th. Over the weekend, the site will move to the Southwest Iowa Transit Agency facility located at 3236 Nebraska Avenue in Council Bluffs and will open for testing at 8 a.m. on Monday, December 7th. I want to especially thank the Pottawatomie County and Southwest Iowa Planning Council for their partnership to make this site possible. When they heard that we were having some challenges identifying an enclosed location for winter, they stepped up and generously donated the space for our use to ensure that Test Iowa would continue to be available for people in their surrounding communities. Since the start of the pandemic, ensuring our ability to continue to increase testing capacity as needed has been one of our highest priorities. The more people that are tested, the more we know about the virus activity in Iowa, and the better we can plan targeted mitigation efforts to manage it. Again, protecting our most vulnerable, preserving our healthcare resources, and getting life and business back to normal. So not only have we now doubled capacity for Test Iowa, the State Hygienic Lab is also poised to double its capacity to process both non-test Iowa PCR or molecular test for various healthcare providers across the state, including hospitals, clinics, and long-term care facilities. A strong testing strategy is critical to our strong recovery, and I want to take this opportunity to thank everyone involved with the Test Iowa, and especially Dr. Pendella and his team at the State Hygienic Lab for the work that they've done to ensure that Iowa is a leader in this effort. So COVID-19 and the mitigation efforts necessary to respond to it have impacted people's lives in many different ways. From the loss of income to the inability to pay for rent or utilities to the dramatic rise in food insecurity among Iowans. The unintended consequences of COVID-19 are a burden that weighs heavily on too many. While the virus is a threat to our physical health, living with its uncertainty over several months can also affect our mental health. The Iowa Department of Public Health reports that between March and September of this year, 319 Iowans died of suicide, a rate slightly higher than the 2 previous years. And anecdotal information suggests that people are waiting longer than usual to seek help and are often already in crisis mode by the time that they do. In a national tracking poll by the Kaiser Family Foundation conducted in mid-July, 53% of U.S. adults reported that their mental health was negatively impacted due to worry and stress about the virus. More than 1 in 3 adults reported symptoms of anxiety, depression, or depression during the pandemic. But adults aren't the only ones suffering. Studies also show that existing mental illness among adolescents may be worse because of the pandemic and with school closures. They do not have the same access to the key mental health services. It's important that Iowans understand the signs and the symptoms of stress, anxiety, and depression, and what to do if they when they recognize them in themselves or someone that they know. Now more than ever before, additional resources are available to help, including COVID Recovery Iowa, which offers free virtual counseling and assistance for all Iowans. Today, I've asked Karen Hyatt, Emergency Mental Health Specialist with the Iowa Department of Human Resources, to share information about how the pandemic is impacting mental health, when people should seek help, and how COVID Recovery Iowa can exist.